Hi from AOD. We look forward to meeting with you to answer any questions. This video will review the medication abortion process with AOD. Our goal is to make medication abortion as easy and accessible as possible. With decades of experience in abortion care, our team has treated thousands of virtual patients across more than 20 U.S. states. This video highlights the key information. Instructions are also in written materials in both digital and print form. Medication abortion mimics a natural miscarriage. The process is safe, and millions of people have had medication abortions. This protocol has been standard for more than 2 decades and is the most common means of accessing abortion care in the U.S. There are 2 different medications to complete the abortion: mifepristone and misoprostol. Mifepristone is the abortion pill. Swallow this pill first with water. Most people don't feel anything at all after just mifepristone. It blocks the hormone needed to continue the pregnancy. You will then wait 24 to 48 hours before using the second set of pills, misoprostol. These make your uterus squeeze. We recommend placing 4 misoprostol pills in your cheek pockets and letting them dissolve. If they have not fully dissolved, you can swallow the rest after 30 minutes. If you prefer, you may place the 4 misoprostol pills in your vagina instead. The heaviest bleeding and cramping usually starts shortly after the 4 misoprostol pills. If you have no bleeding at all after a full 24 hours, you may repeat the misoprostol. Note that for people who are 9 weeks or more into their pregnancy, we advise you to repeat the misoprostol 4 hours after the first dose regardless, even if you're already bleeding. Information about this step will be provided in your kit. Common side effects of the misoprostol include nausea, diarrhea, chills, and a brief fever. We strongly urge you to take both the nausea medicine and the ibuprofen included in your kit before using misoprostol. Cramping with medication abortion is expected and can be intense. There are no activity restrictions. We ask that you use only pads the first few days. This helps measure heavy bleeding. The average time for bleeding is 10 days, with the heaviest part at the beginning. But anywhere from 4 days to 4 weeks of bleeding, with it stopping and starting, is still normal. There is a very, very wide range of normal bleeding. Your bleeding may not follow an exact pattern. Clots are common. Blood is meant to clot when it is sitting still. These clots expand in water. Your next period, which may come anywhere between 2 weeks and 2 months later, will likely be heavier than usual. This is normal. There is nothing you need to look for or at when you are passing the pregnancy. If you are more than 8 weeks into your pregnancy, you may see tissue you recognize. Most people see only clots. For very early pregnancies, less than 6 weeks, you may have very little bleeding, even lighter than a period. This is also normal. Our routine follow-up is by automated text. All of our texts are designed to look like spam for extra privacy and don't reference abortion in the messages. The first text is a symptom checker sent 1 week after the clinician signs your order. If you answer in a way that would make us concerned, it routes you to our call line to do a phone check-in during normal business hours. The second follow-up text is a reminder to take the pregnancy test in your kit after 5 weeks. Please wait until you get a prompt from us to take the pregnancy test, as it can take at least 4, sometimes up to 6 weeks for your pregnancy test to turn negative. Medication abortion is highly effective, around 98%. The fastest measure to know that it worked is that pregnancy symptoms are gone within a week of taking the medication. Bleeding, cramping, and passing clots are also good signs that it is working. Most common overnight questions are answered on the QR code provided. Please start there. If you are soaking front to back, no white patches left, 2 extra large pads an hour for 2 hours in a row, or if you have a fever more than a day after taking both medications, please call the emergency phone number provided on the reference sheet. Medication abortion by telehealth is very safe. It is at least 10 times safer than a term delivery. There are still some risks. One of the most serious risks includes an undiagnosed ectopic pregnancy. That's a pregnancy outside of the uterus. Medication abortion does not cause or worsen ectopic pregnancy. It's just not the right treatment for one. An ultrasound is not required for most people. But if you get severe pain on only one side or severe lightheadedness, we want you to be seen in person right away. Other risks that are serious but extremely rare, approaching 1 in a million rare, include hemorrhage, death, and infection. These might sound scary, but the more common risk statistically is the small 2% chance that it might not work. Our text-based follow-up is meant to catch continuing pregnancies quickly so that we can coordinate care with in-clinic colleagues. In most cases, our fee does not cover the cost of in-clinic care, but we will make sure our partners have everything they need to take care of you well. Alternatives to medication abortion by telehealth include medication abortion in person, a procedure abortion, or continuing your pregnancy. If you'd like birth control prescribed, pills, patches, or rings, you may discuss that with your provider during your video visit. After your virtual visit, forms and payment are completed digitally. We will then send the order to one of our pharmacy partners for overnight express shipping. You can expect a notification with tracking information. All kits are shipped the same day for orders signed before 5 p.m. Eastern or next day for those completed later. Your kit comes in a discreet package with no reference to abortion or medication. Detailed instructions are included in your kit, as well as a QR code you can scan for quick answers to the most common questions. Our team is also happy to help.